Welcome to the class today. I am your regular anchor, Negedu Godwin. Today we are going to be discussing interaction of ultrasound with tissues. And I want to show acknowledgement to these wonderful people who have contributed greatly to my knowledge. First, let's understand attenuation, because that is the major thing that happens when sound travels through tissue. So, what is attenuation? Attenuation is the progressive reduction of amplitude and intensity of the ultrasound beam, as it travels through various tissues. Attenuation weakens both the pulse and the echo as they propagate through the medium. From an imaging perspective, attenuation is responsible for limiting tissue penetration and depth. The further through the tissue that the sound will travel, the weaker it becomes due to multiple interactions. Now, to solve this problem, the ultrasound machine has provided a solution, and that solution is found in the time gain compensation, TGC. Two identical interfaces that are situated at different depths within the body will theoretically should be recorded as identical echoes, right? On the ultrasound image. But by the time the ultrasound beam has reached the deeper interface, it has lost all the energy through attenuation, and there will be less energy that is reflected, and the display becomes darker on the screen. But time gain compensation is used to compensate this situation or this attenuation that occurs due to distance and depth, and is also called depth attenuation. So how does attenuation occur? Attenuation is caused by three different processes: absorption, reflection, scattering. Absorption here is the conversion of ultrasound energy into heat energy within the tissue. Absorption is the primary mechanism of attenuation in soft tissue. As ultrasound beam travels through normal soft tissue, approximately 80% of the sound beam energy is attenuated by absorption. That's to say, absorption of sound energy and conversion to heat energy plays a role in a potential adverse effect, which we'll look at in biological effect. So the higher the absorption, the greater the potential thermal effect or the heat production. Absorption is directly proportional to the sound frequency. The higher the frequency, the higher the absorption, and vice versa. Now, this is why penetration is inversely related to transducer frequency. That's to say, sound absorption is equals to heat. In reflection removes energy from the beam by redirecting some of the sound back to the transducer. So reflection occurs at a large smooth interface, such as wall of vessels or capsule of organs, which were specular reflectors. While in scattering removes energy from the beam by redirecting it in many different directions. Scattering occurs at small or irregular surfaces, such as parenchyma of organs or tissue, such as fat. Those ones are non-specular reflectors. And 20% of attenuation will occur by reflection and scattering. What are the factors that affect attenuation. Number one is medium, and the other one is frequency. The different media would attenuate differently. For example, fluid is a low attenuating medium. Sound travels through fluid without losing much energy. In contrast, bone is a high attenuating medium. So bone removes a great deal of energy from the beam by the mechanism of reflection and absorption. That's to say, sound will easily penetrate a fluid-filled medium but will not penetrate through bone. There are categories of media. We have the low attenuating medium, average attenuating medium, and the high attenuating medium. The frequency, higher frequencies are attenuated more than lower frequencies, while lower frequency will penetrate more deeply than higher frequency because they are attenuated to a lesser degree. So let's look at attenuation of soft tissue vis-a-vis bone interface. Here it is very high due to high absorption of sound energy by the osseous tissues. And it's also very high with air to soft tissue interface due to the extremely strong reflection at soft tissue to air interface. And this also is due to high acoustic impedance mismatch. About 99% of incident ultrasound beam energy is reflected at the soft tissue air interface. This attenuation that occurs results to artifacts. And attenuation artifacts will cause things like acoustic shadowing. So when attenuation is excessive, as in the case of bone, you see that in calcification, you see that in stones, fibrous tissue or air, an acoustic shadow can be seen deep or posterior to the strong attenuator. However, besides absorption and reflection, acoustic shadowing is also dependent on other factors. Beam width and frequency forms those factors. So as a general rule, the higher the frequency and the smaller the beam width, the stronger the acoustic shadow. Again, attenuation artifacts can be seen in acoustic enhancement. So when attenuation is low, as in most biological fluids, there is increase in transmission of ultrasound energy deeper to the fluid containing structures. And acoustic enhancement, which you otherwise call through transmission, is seen posterior to the weak attenuator. The degree of acoustic enhancement is dependent on attenuation property of the fluid, the size of the fluid space, and transducer frequency. This table shows us a list of biological media and relative amount of attenuation in them. You have high level attenuation. It produce artifacts that's called acoustic shadowing, and you see that in gas, air, lungs, bone, stones, calcification, fibrous tissue, adipose tissues. While medium level attenuation, you see that in most soft tissue and organ parenchyma, while low level attenuation produce artifacts that is acoustic enhancement, or what you call through transmission. And you see that in simple fluid like simple cysts, complex fluid like blood, bile, abscess, or pus. So what is the unit for attenuation? Attenuation is measured in decibels. And this decibel is always a negative decibel, as it is reduction in amplitude or intensity of the sound energy. Now, there's such thing as attenuation coefficient, and it is the rate of attenuation. The amount of attenuation that occurs per centimeter as the sound travels through the medium is called attenuation coefficient. Greater the distance of travel, the greater the amount of attenuation. Unit for attenuation is decibels per centimeter. That is unit for attenuation coefficient is decibels per centimeter. So let's look at attenuation coefficient in soft tissue. The typical value for attenuation coefficient in soft tissue is 0.5 decibels per centimeter. This means that for every centimeter that the sound travels through a soft tissue, it is attenuated by 0.5 decibels. Attenuating coefficient is also frequency dependent. The higher the frequency, the higher the attenuating coefficient. Typical value for attenuating coefficient in soft tissue, like we've said, is 0.5 decibels per centimeter. Now, this will mean that for every centimeter that the sound will travel in soft tissue, 0.5 decibels is attenuated. But as we know, attenuation is frequency dependent. So attenuation coefficient is also frequency dependent. The higher the frequency, the higher the attenuating coefficient. We can write the attenuating coefficient in soft tissue to be AC, which is attenuating coefficient, equal to 0.5 decibels per centimeter per megahertz because of the dependence on frequency. It is also dependent upon the transducer frequency. That's why we introduce the megahertz. So increased frequency, increased attenuation. Increased depth or distance, increased attenuation. Increased frequency will reduce penetration. Increased attenuation will reduce penetration. Let's look at acoustic interfaces. Acoustic interfaces are media boundaries which reflect part of the sound energy in incident ultrasound beam. For diagnostic ultrasound purposes, interfaces exits where when the media boundaries have different acoustic impedance. Acoustic impedance is a value which indicates a material's resistance to the propagation of sound. The acoustic impedance is the ease with which a sound wave can form within the medium. What are the important features of acoustic impedance? It is a difference in an acoustic impedance that can produce an acoustic interface. Never forget, the greater the difference in acoustic impedance, the stronger the reflection from the interface. The smaller the difference in acoustic impedance, the weaker the reflection from the interface. If there is no difference in acoustic impedance, there is no acoustic interface and there will be no reflection. In such cases, only sound transmission will occur. That is through transmission. Acoustic impedance can be demonstrated in this relationship, which is acoustic impedance equals to density times speed of sound. Acoustic impedance value of tissues are used to determine the magnitude or strength of returning echoes. The greater the difference between two tissue impedances, the greater the strength of reflecting echo amplitude at that interface. Most soft tissue have very similar acoustic impedance with slight variation. Therefore, the echo amplitude at a typical soft tissue interface are actually almost the same. Now, that's to say 1% to 10% of the incident sound amplitude. Air to soft tissue interface and bone to soft tissue interface result in high echo amplitude because the acoustic impedance mismatch is high in both of these interfaces. For this reason, air and bone are strong attenuator and very difficult to penetrate. This table shows the value of acoustic impedance for various tissue. Air have the acoustic impedance of 0.004, soft tissue has 1.63, bone has 7.80, according to their level of attenuating strength. Now, reflection of incident ultrasound beam make up the basis of ultrasound imaging. Now, when there is an acoustic impedance mismatch between two tissues, even in very small difference, a percentage of the beam will be reflected. The remainder will be transmitted through the interface and it will continue to produce reflections until the ultrasound energy is exhausted. So reflection can be produced by two methods: perpendicular incidence, oblique incidence. So what is perpendicular incidence? When the incident beam is perpendicular to the interface. With perpendicular incidence, the part of the beam is reflected at the perpendicular interface, and the remaining transmitted sound continues through to the second medium in the same direction as the incident sound. However, how much percentage of sound will be reflected from the perpendicular incidence? Now, the percentage of the reflected sound is actually determined by the acoustic impedances of the two media that will make up the interface and the angle of the incident beam to the interface. So maximum sound reflection will occur at a 0-degree angle or at perpendicular incidence. The greater the acoustic impedance mismatch between the interface. So what we have is we have more reflection at 0-degree angle and a greater acoustic impedance mismatch. Let's look at intensity reflection coefficient, what we want to call IRC. The equation for percentage reflection at an interface with normal incidence is called intensity reflection coefficient, IRC, and you can also call it the acoustic mismatch equation, or percentage of reflection equation, which you will demonstrate as this equation. IRC predicts the strength of echo. A large IRC means strong echo. The greater the difference in acoustic impedance, the greater the percentage of reflection. So with all that happening, especially the acoustic impedance mismatches, especially with air and bone, but particularly with air, this is the reason why ultrasonic gel is introduced. Because a lot of people have asked, why is ultrasonic gel introduced? So there is a huge acoustic impedance difference between soft tissue, which has an acoustic impedance of 1.63 rods, and crystal, which has 29 rods. Hence, an extremely strong echo will be reflected from the interface between the soft tissue and the transducer, with a very little percentage of sound energy being transmitted into the patient. This is why gel is used. Ultrasound gel have an intermediate acoustic impedance. This reduces the acoustic impedance mismatch, thereby improving the transmission of sound into the patient and the reception of echo from the patient. There are types of reflectors, and reflectors can be classified based on the size of the reflector relative to the wavelength of the sound wave. There is a specular reflector, there is the non-specular reflector, or what you call backscatterer, and there is the relay scatterer. Let's take the first one, specular reflections. Specular reflections occur when the reflecting surface is large in comparison to the wavelength of the incidence of the sound beam. Specular reflections occur at organ boundaries, at the surface of large blood vessels. For example, of large surfaces, you have the diaphragm, capsule of the kidney, wall of aorta, wall of the common bile duct, pericardium of the heart, and so on. So specular reflection is very angle dependent, but essentially frequency dependent. The actual amount of sound energy reflected at the specular interface is dependent on acoustic impedance mismatch. What about non-specular reflector or reflection, backscattering? This occurs when the reflecting surface is approximately equal to or is small in diameter in comparison to the wavelength of the incident sound wave. The portion of the sound energy returning to the transducer is known as backscatter. It is detected as relatively weak echo by the transducer in comparison to the echo amplitude from specular reflectors. So backscattering occurs in heterogeneous materials such as parenchyma of soft tissue, liver cells, kidney cells, pancreatic cells, or myocardium of the heart. It also will occur in pathological masses. It will occur in fluid collections that contains significant particulate matter. The amplitude of backscatter is relatively angle dependent but very frequency dependent. That is to say, as transducer frequency is increased, so does the size of the backscattered echo. Scattering is a significant factor for attenuation. In soft tissue, attenuation is related to both absorption and scattering. Both of these processes increase with sound frequency. Now there is the relay scattering, and this occurs when the reflecting surface is too small in diameter in comparison to the wavelength of the incident wave, for example, red blood cells. Under normal circumstances, red blood cells are too small that echoes emanating from them of the blood cells are too weak to be detected and display on the image. So blood basically will appear anechoic or echo-free. However, if the blood flow velocity is sufficiently slowed, blood flow echoes may be seen in blood vessels, especially due to red blood cell aggregation, which forms a larger effective scattering target and produces an echo which is sufficiently strong to be detected and displayed. What is oblique incidence? This is a method by which reflection can be produced. Oblique incidence occur when the ultrasound beam is directed towards an interface other than the perpendicular angle. With oblique incidence, no echo is returned to the transducer, and the sound beam is attenuated because it is reflected away from the transducer. Or the sound beam must be reflected back to the transducer in order to produce an echo or image. Refraction. This is the bending or the changing of direction of a beam as it passes from one medium to another. As refraction occurs with oblique incidence, or the sound beam does not return to the transducer and therefore is attenuated. Now, it plays no role in image production. However, in some instances, refraction will produce artifacts, and we will discuss that in an artifact lecture. So what conditions must exist for refraction to occur? The incident angle of the beam must be greater than 0. That's to say it must be an oblique incidence. The velocity of sound between the two adjacent medium must be different. Law of refraction according to Snell's law. Sound refraction will cause the transmitted wave to change its direction as it passes from one medium to another. So the degree of refraction will depend on difference between the velocity of sound through the two medium. The greater the difference in velocity, the greater the amount of refraction. The direction of and the degree of refraction of the transmitted beam is determined by Snell's law, and that is Snell's law. The direction of the refracted beam depends on the velocity of sound medium relative to the first medium. If the second medium has a higher velocity, the beam is always refracted away from the normal incidence. The transmission angle will be greater than the incident angle. Conversely, if the second medium has a slower velocity, the beam is always refracted towards the normal incidence. The transmission angle will be less than the incident angle. Refraction does not occur at perpendicular or normal incidence. So is refraction of clinical importance in ultrasound imaging? It plays no role in image production. As refraction occurs with oblique incidence, the sound beam does not return to the transducer, and therefore attenuation has occurred. But in some instances, refraction will produce artifacts. We've mentioned that before, and we're going to deal with it on artifact lecture. Refraction at the edge of a curved structure may produce acoustic shadowing, and this type of shadowing is known as edge shadowing or refraction artifact, which will be different from acoustic shadowing. So let's look at some terminologies that is associated with image characteristics. And we have a homogeneous. This will mean uniform composition, and it will be used in the sense of uniform texture. The normal texture of many parenchymal organ is homogeneous because the cellular tissues are acoustically similar, like you find in the liver, spleen, pancreas, thyroid. Heterogeneous will mean not uniform composition. It has uneven or coarse echo texture. Echo is a reflected sound wave and is synonymous to reflection. Echo brightness. In a grayscale image, echo brightness represents the strength or amplitude of the echo. Echo brightness depends on many factors, and we'll dealt with it in some other lectures, but we'll still look at it in lectures to come. The word echogenic is used with respect to ultrasound imaging which has echoes, and synonymously you can use the word reflective or echo producing or echoic if you wish. Echolucent means Ultrasound image has no echoes and is synonymous to sonolucent, anechoic, or echo-free. Hyperechoic describes a structure which has many bright echoes in an ultrasound image. You can also use the word hyperechogenic. Hypoechoic describes a structure which has few echoes in an ultrasound image. The synonymous word would be echo-poor or echopenic. Isoechoic describe image that is having the same echo brightness as the adjacent structure. Normal spleen may be isoechoic to normal liver. If a solid metastatic lesion in the liver is isoechoic to the normal liver parenchyma, it may not be visualized. So I want to thank you for joining this lecture. Please like, share, subscribe, and put on your notification to receive all our free lectures. For more information about our paid classes, please send an email to sonoeyesdiagnostics@gmail.com or WhatsApp me at +234 9019 144 175. Or you can visit our online store at amberneck.business.site or sonoeyes.business.site. Attempt the quiz in the description and leave me a comment. Until next time, when I come your way again, keep learning ultrasound.